welcome to our Forgotten Guideline Strength Messaging Insight webinar. It's so good to see so many of you here, and we're really excited to share the last 18 months of work that we've been doing together. So I'm not going to spend too much time introducing. I'm going to pass over to Mike for that and to welcome, but just 3 admin points from me. First off, the session is being recorded. No, it's not. The session, hi, welcome. The session is being recorded, yay. So if you need to dive off at any point, then please do. We'll send a link round to everybody that's registered after the meeting. So that will be available to everybody. The questions, we do have time in the agenda to ask the questions, but please do fire them through using the Q&A chat box. If we reach capacity, we're live streaming on YouTube, and the option for people viewing from YouTube will be using the comments box below the screening. Finally, I'm going to hand over to Mike Diper now from Sport England, who is going to give us a bit of an introduction about the seminar. Thank you.
Thanks, Sarah, and good morning, everybody, and a welcome from Sport England. Those of you who were on the call really early got the comedy routine between the presenters and me popping up as Susie Gitters, but you're going to hear from her in a moment or two. I'm Mike Diper. I'm one of the directors at Sport England, and I just really wanted to underline this morning the importance of this work. Some of you might wonder why this is important to Sport England. It's actually one of the big foundations which helps us move, gets us active. For some people, allows them to play sport, and actually without strength and conditioning, none of that actually would happen. And one of my own personal journeys has been thinking about the importance of this in our children's work. So it's fantastic. I can see the number of participants growing all the time. It's up to nearly 300. I think there was something like 650 people registered. And that just shows how important this agenda is. Strengthening activity is so important to our muscle, our joint, our bone health. And I think after the year we've had, it's nearly a year of the pandemic. For those who've been sheltering, all of us who've been subject to the lockdown restrictions, actually building up our strength and conditioning again is essential. So it's really good. We're going to be hearing from, in a moment, Susie Gitters, who's from our health team at Sport England, but also the Chartered Society for Physiotherapy, Britain Thinks, and Move Consulting, on what is simply a really great piece of work and a great partnership. So thank you for being with us. I hope you find this morning really, really useful. I'm going to hand over now to Sarah, Susie's.
Thanks, Mike. So good to see all of you. I'm sorry it's not in person in this kind of virtual world we're in at the moment, but good to see so many faces. As Mike mentioned, I'm Susie Gitters and I work in the health team here at Sport England. There's going to be a little poll that's going to be popped in the chat in a minute. Please do share sort of your area of work. That's of real interest for us moving forward. It'd be great if you could just answer that briefly. You just need to click on which option suits or represents you the most. That would be great. So I'm going to tell you a little bit about, I guess, how strengthening works for us and within the context of our new strategy. As I'm sure you'll be aware of, that we have a new strategy that launched last month. Next slide, please, Sarah. Thank you. So what are we talking about here? We're essentially talking about activity that makes your muscles work a bit harder than usual, and that's typically associated with feelings of fatigue a bit quicker, shakiness and muscle warmth. And it typically uses your own body weight, or it can be done against kind of resistance, such as freehand weights or resistance bands. There's also lots of sporting activities that are great for strengthening, things like anything that's sort of a striking motion, so things like tennis, rounders, lots of in the fitness side of things like yoga, holding postures against your own body weight, and also some everyday activities that people partake in. So things like walking up and down your stairs, gardening, and carrying your heavy shopping bags. So the type of activity, this type of activity was really acknowledged with its importance when it was added to the physical activity CMO guidelines back in 2019. And that was not to just the adult guidelines, that was across all the ages from children to older people, and some of those specialist guidelines as well, so pre and postnatal. And that's really because of the strong evidence base and the crucial role it plays in keeping our muscles, bones and joints healthy, not just in terms of prevention of musculoskeletal conditions, but also the role it plays in keeping us active and independent as we age. So yes, it sits up alongside the aerobic activity within the guidelines. But since 2019, really, it's been branded the forgotten guideline because it really has been overshadowed by aerobic, and it seems to be in terms of promotion and sometimes delivery as well, that the strengthening activity is overlooked. Next slide, please, Sarah. So delving into a bit more around about why it matters. Next slide, please, Sarah. We know that our bone and muscle strength is developed mostly when we're younger, and therefore we need to build a strong foundation. So you can see there that bone density is developed by an average the age of 18 to 20 years of old. So looking at the kind of childhood and adolescence and youth time is a good time to invest in bone health. And that really plays into, as Mike mentioned, our children and young people's section of our new strategy around building positive experiences and solid foundations for children to be active as they grow. And in particular, the strengthening activity is one of those most important factors in terms of that healthy bones and muscles. So the more strengthening activity and more active children can be when they're younger, the more likely they are to, as they age, have that healthy active habit. And it can prevent from conditions such as osteoporosis. Now, this, unfortunately, is a little bit of a depressing slide, because what it actually shows is how our muscle and bone strength naturally declines for us all, sadly, with age. And you can see from the graph there that the actual peak of that is around about when we're 30 years of age. And it decreases at a rate of around 3 to 8% per decade. So it's the sort of thing where year on year, you don't really see too much of a difference, but actually when you start looking back 5, 8, 10 years, you often hear comments like, I used to be able to do this, I can't do that anymore. And that's often related to muscle and bone strength. So the green line on this graph represents a projection of people doing strengthening activity on a regular basis compared to the blue line, where you can see there's a quicker rate of decline and a quicker rate of loss of function, showing people that don't take part in regular strengthening activity. So really Sport England have a bit of a leadership role to play here to make sure that everyone, as much as possible, can be on that green line trajectory and really get the benefits of strengthening activity. Next slide, please, Sarah. So as Mike was alluding to, that it really is the foundation of all movement when you think about it. So thinking about those physical activity behaviours, so people who are inactive, you need a minimum level of muscle strength and function to enable you to take part in aerobic activity. And that's never been more so important, now relevant due to the COVID-19 pandemic. So we know, we're hearing a lot from partners and the population that people are physically deconditioned at the moment. And particularly there's some inequalities there around people who have been shielding, people who are living with long-term conditions, have a disability, or are kind of the over 55s age category. So really, it's a really important role that strengthening will play for those people to gain back physical function and enable them to get moving aerobically again. But equally, on the other side of the continuum, we have people who had an active habit before they were going into lockdown. And strengthening activity has a really strong evidence base for helping people transition back to those sporting activities that they love to do when restrictions ease again, in terms of a way that is safe and avoids injury. And my husband is a classic example of this. So when we look back to when we had the regional tier restrictions that came in, our area was quite lucky, and we had lots of sport and physical activities that were still open outdoors, and he went straight back to his five-a-side football, having not done it for 4 months, and pulled his hamstring within 15 minutes and has been out for about 7 or 8 weeks now. So yeah, just a live example of how strengthening activity is also really important for those who are active and returning to sporting activities as well. So that, in reference to our strategy, is around that kind of recover and reinvent section or big issue around supporting people to return, and the sector to help people to return to the activities they love. Next slide, please. And equally, strengthening activity plays a strong role actually in responding to some major health trends, which really impact the ability for people to take part in physical activity. And one of those health trends is muscle and bone problems, also known as kind of musculoskeletal problems, essentially covering joint, muscle, bone, and kind of spine pain. And we know we have a lot of people, so 10 million people out there living with long-term pain around these conditions. And they take up a lot of the healthcare system time. So they're accounting for 30% of all GP appointments. So there's a lot of support that's needed for people around this area. And key to that is actually being physically active is one of the best things someone can do in terms of keeping their muscles strong, their bones healthy, and reducing pain and the management of their condition. So it's really important that we raise the profile of strengthening activity to play a role within that space. Next slide, please. And equally, it's a bit of a health trend within itself. There is a real lack of take-up of strengthening activity, and it's not particularly well measured, but we do have a measurement within the Health Survey for England, and that tells us that there's only 31% of men and 23% of women that actually do those muscle strengthening guidelines. So a high proportion of people aren't taking part in them, and actually there's a really low lack of awareness. We do have a new measure coming out in April within our Adult Active Lives, where we'll be starting to measure the strengthening of the nation. So that's a great news in terms of the measurement space. But in terms of thinking about what helps to raise awareness, what helps people to start thinking about strengthening activity, and how can we support people to transition and do that, is a space that we moved into probably about 18 months to 2 years ago. And that was really why we embarked on this investment with CSP and the Centre for Ageing Better, which was because they're really specialists in this field and experts within this knowledge, and they're a trusted source within healthcare professionals and for patients. So we embarked upon exploring a little bit further what are the messages that can really help people to do strengthening activity, and what kind of concepts or behaviour change interventions might support the take-up and really increase those numbers that we've got doing strengthening activity already. So without further ado, I will pass you over to Sarah Hazard from the CSP, who will tell you a little bit more about what they do, and then we'll drop into some of the detail of the project.
Brilliant. Thank you, Susie. Can I just check, panelists, can you hear me? Yeah, okay, good. Okay, so we've got lots of people who are from the physio profession listening in, but also lots of people who are, of you who are involved in strengthening and working with same groups of people to get them stronger. So for those folks who are a little bit less familiar with the profession, oh, there's the results of the poll. There you go. So last year we celebrated 100 years of the Royal Charter, and in that time the profession's obviously changed immeasurably, really, but most people wouldn't be faulted for automatically sort of coming up with that image of a practitioner sort of coming onto a sports field to treat an injured athlete. And that is a part of the profession. It's about a fifth of it, but the profession is also much wider. And so got everything from people working with in cardiac, in pulmonary, neuro, frailty. We've seen a lot of imagery over the course of this pandemic of the physio workforce in hospitals, in ICUs, intubating patients. And of course, some of the biggest, most remarkable transition of the profession in the last decade with first contact practitioners and GP surgery. So Susie very helpfully sort of laid out that landscape there of up to a third of those appointments being MSK related. And so we're increasingly seeing those first contact practitioners playing an enormous role in taking some of that pressure off that part of the system with GPs. But also, we're now currently working with 44 organizations, other professional bodies, patient organizations, and charities in the Community Rehab Alliance. And the reason for that is to really ensure that patients everywhere have access to their right to rehab, which is part of that is a big part of that is based on strengthening and getting people closer to their goals. So if we go to the next slide now. So this has been largely sort of covered off, but just to really ensure that the background of the scene setting is there. Well, we know these are some of the things many of us, and certainly you will know, that 15 million people living with a long-term condition, that number is not going to go down, it's going to go up over the next decade. People will live with an increasing number of those conditions. We'll have an increasing, aging population, which will add to that. And of course, now more than ever, combating inactivity. So there was certainly a huge level of unmet need prior to the pandemic. Clearly, there is an enormous amount of new unmet need and deconditioning. So what came together in 2019 was both the adding of strengthening to the amended Chief Medical Officer guidelines, the research and insight and campaigning we did around love, activity, hate, exercise ? Which really helped us to understand what patients and professionals and practitioners shared in common, and where those feelings and those behaviors were different. What was very encouraging then and still holds in the insight that you're going to hear more about shortly is that the physio workforce is very much seen as the advisors, the reassurers, the referrers, and the pain relievers. So what was important in 2019 really is just that much more important now. So if we go to the next slide. No better way to do this than no way to do this without doing this in partnership. Really, that alignment felt really natural. What's really encouraging is the way that Sport England has launched its next 10-year strategy, and that alignment has only grown closer from our point of view. We worked with several agencies at different stages of the work so far, and you'll be hearing from 2 of them today. So next slide. Thanks, Sarah. Okay, I think I might have frozen there for a moment. Am I back?
Yeah, we can hear you.
Can you hear me, Sarah? Sorry, I think I froze there. Oh
okay,
boy, this is the Scrum
project aims and objectives. Do you have that one, Sarah?
Right, that's good. This is the Scrum. I'm sure many people are familiar with for the Wi-Fi when all your children have not quite been phased back into the educational system. Okay, so the aims of the work really twofold, but they're related. The first was to create this sort of legacy for messaging that really engages the target audience and really takes people from agreeing or understanding or feeling that they're being understood to actually doing something and that behavior change really becoming sustainable. And identifying, within that, how that happens, and then how we're going to scale that up, who we need to do that, how we use physios and other allied health professionals and other people also in the wider activity space. So there were 5 elements, and we're gonna focus later on in the overall presentation on the last bits. But we started off with just getting that messaging that would be effective around people who are inactive or fairly active with long-term conditions. Then looking at the physio staff and raising awareness about how promoting strength and supporting their patients through behavior change, what's needed to do this. creating shareable recommendations from that insight around the concepts, the messages that are most likely to get that cut through, and really, therefore, what's most effective or going to be most effective with that sort of influencing. Where we're at now is around determining the size and scale of the opportunity for this awareness and behavior change amongst the target audience and via physiotherapy staff. And then finally, we'll be looking, go back one slide, to develop the recommendations for phase 2, which messages and concepts are going to go the widest, what can be scaled up in real life settings, who does that, and how will they do it. So on that point, I'm going to hand over to Raf from Britain Thinks, and I'll see you again at the end.
Great, thank you very much for the introduction there, Sarah. So my name's Raf. I'm a research director at Britain Thinks. Britain Thinks is a research agency, and we were delighted to work with the CSP on this project. I'm going to share some of the insights and learnings from this program of work with you today, and I hope you find them useful and interesting. First, I'm going to quickly chat through what our approach to this was, and I won't go into lots of detail because there is lots of detail, but just so you're aware of what the shape of the research program was. In March last year, we conducted some exploratory research. We engaged 18 people with a variety of different long-term conditions in a diary task, but also some in-home depth interviews, really to understand their experiences of strengthening, where, if at all, it fits into their lives, their awareness of strengthening guidance, potential motivations to do strengthening, and potential barriers to doing strengthening as well. We also did some focus groups with physiotherapy staff to understand their experiences of providing guidance to this audience, and any other kind of insights and learnings they were able to share with us about people with long-term conditions. After that exploratory research, we then went through a number of different phases of testing different forms of stimulus, both with people with long-term conditions and physiotherapy staff, essentially to let us understand what messages, what concepts, what initiatives resonate with them, ultimately to understand what works and what doesn't. In terms of and I'll go through each of these phases one by one now and share with you the key learnings from each. So if we can move on to the next slide, starting with the exploratory research then. I'm going to share with you the sort of key insights from the research with people with long-term conditions. So if we can move on again, please. The first insight from that exploratory phase was really that there is no typical inactive person with a long-term condition, even though we focused on a relatively narrow age band and quite a defined audience in terms of the types of condition they had. We still found that this was a really diverse audience, both in terms of the nature and impact of the health condition on their day-to-day lives, their sort of mental health, but also just their mindset more broadly, how optimistic or pessimistic they are, their previous experiences of physical activity. So whether they have never really done much activity and been inactive for a long time, or whether actually they used to be quite active and do quite a lot of strengthening and have recently stopped doing that. And finally, there was a variety of other sort of demographic and lifestyle factors that played a part in terms of affluence, whether or not they lived with children, whether people had caring responsibilities, whether they lived in rural or urban settings. All of those things meant that this was a really, really varied audience and did make it quite hard to generalize too much about them. But there are nonetheless a number of common themes. And the second insight and a common theme was really that the concept of strengthening activity is much less front of mind with this audience than cardiovascular exercise or physical activity more broadly. And we found that baseline awareness and understanding of strengthening guidance is really limited. So when people think about strengthening activity, they think quite narrowly in terms of building muscle, lifting weights, going to the gym. And it's quite a narrow interpretation of what that means. And we found that people really didn't feel confident about how much they should be doing or how to do it. We also found that there's real potential for confusion when it comes to providing strengthening guidance, and a real risk of conflation with just physical activity more broadly. And when we showed people the CMO guidelines to do with strengthening, they were perceived to be quite vague and unhelpful. It wasn't clear what strengthening was required and how much to do it. The fourth insight from the exploratory phase was we did detect some underlying desire to do more general physical activity, and some interest in understanding more about strengthening activity, which to us suggested that there was some potential motivation to change behaviour that this initiative could tap into. And in particular, we found that benefits, when we tested a whole range of different potential benefits to do with strengthening, and the ones that resonated most with this audience were those that related to broadly doing more. So the ability to complete daily activities, lift grandchildren, that sort of thing, play with children, and those benefits that related to feeling better, for example, managing one's health condition or just improving mood and self-esteem. Those tended to be more motivating than longer term, more abstract medical benefits. However, despite this sort of underlying potential motivation, we found a number of barriers. And in particular, low awareness and understanding of strengthening activity, as I've already mentioned, was a real barrier. But there was also a perception among this audience that their health condition somehow inhibits activity or would actually get worse as a result. And that was a perception that stopped people from engaging or made them slightly worried about doing strengthening. But as I mentioned earlier, there's a whole host of different barriers, of other sort of secondary barriers that this audience faces. So just going back to this point about motivations, because we think it's quite interesting to provide some detail here. There's sort of spontaneously, because people don't really know much about strengthening, they don't really know what the benefits of strengthening are, or struggle to articulate this with much specificity. They just say, oh, we assume exercise is good for you. When we really push them to say what the benefits might be, they'd say things like getting stronger, maybe cheering you up, feeling a sense of accomplishment. We then prompted them with a whole host of potential benefits. And as you can see here, the ones on the left are the ones that were less resonant. So things like improving bone density, improved balance and posture, reduced risk of major disease, those sort of slightly medicalized, longer term preventative benefits were less resonant than the ones on the right that relate to doing more, such as maintaining independence, ability to complete daily activities, or feeling better physically or mentally, having improved self-esteem, being able to manage your health conditions and pain. And those were the benefits, the sort of shorter term benefits that were much more resonant with this audience. And moving on to the next slide, in terms of the barriers, again, we looked at a whole range of different barriers for people with long-term conditions. We found that there were lots of different ones that people mentioned. The ones that we felt were most common and most significant were on the right here. So not knowing enough about it, that was the biggest blocker, and that was one that was consistent across this audience. Other very common ones included worries about pain or making the condition worse, or the fact that having a condition just makes it difficult to do strengthening in the first place. Again, those were really common barriers. The other barriers were less common, only mentioned by some, but worth bearing in mind that most people experience at least a couple of these different barriers when they think about strengthening. We also looked at potential messengers on the subject of strengthening. And generally speaking, the messengers that were most trusted on the topic of strengthening by this audience were those who had some degree of medical or health expertise. So health charities, the NHS, nurses, GPs, and physios were all considered to have some understanding of people's health conditions, and that was found to be sort of reassuring and trustworthy. Whereas other potential messengers, such as gym instructors or leisure centre officers, while having lots of expertise in the sort of strengthening and physical activity space, weren't necessarily associated with having high degrees of knowledge about health conditions, and therefore there were concerns that they wouldn't be able to offer advice that was tailored to their particular situations. In terms of some of the learnings from the physiotherapy staff research we conducted, we found that physios all of the physios we heard from really strongly believe strengthening to be important, have a good, really detailed understanding of the benefits, and claim to frequently provide strengthening advice to patients. And we found that they're likely to be willing messengers for the initiative. We found that knowledge of the official CMO strengthening guidelines was mixed. And actually there was quite a lot of criticism of them in terms of how useful and clear and instructive they are, which echoed what we found with patients. And that means that actually they're actually only rarely used in practice when providing guidance. And instead, the strengthening advice that physio staff provide varies quite considerably. And some of that's due to a requirement to be patient specific, but there's also quite a lot of inconsistency in terms of the sort of messages, motivating messages physios use and resources available to them. If we can skip on a slide. The fourth insight from the research with physiotherapy staff was that they really perceived a real number of challenges to providing strengthening advice, including low patient understanding and motivation, lack of time in patient contact, lack of resources, and often contradictory advice from other healthcare professionals. A lot of their patients would say things like, "Oh, I've been told to rest, and therefore I shouldn't be doing strengthening activity." We found that physios have a good understanding of the motivations and barriers faced by this audience, but can sometimes underestimate these softer, more emotional motivators to do with body image or self-esteem, and also the softer, more emotional barriers to do with potentially sort of embarrassment and low mood. We also, if we can skip on in the interest of time. In terms of the next stage of the research, that's what we learned from the exploratory phase. We then started showing research participants stimulus to understand what works and what doesn't. And we shared with them lots of different definitions of strengthening, lots of different types of guidance, different example activities, different motivating messages, existing campaign materials from the UK and other countries, and just to understand what works and what doesn't. And what I'm going to do now is talk you through some of the sort of key considerations and learnings from this phase of the research. One was that it's really important to make inclusivity and relevance explicit. This audience, people with health conditions, can feel excluded from communications about physical activity and sort of instinctively think this isn't something for me, this is for someone who doesn't have a health condition. So it's often necessary to be really explicit that anyone can do strengthening and that it's possible and in fact particularly beneficial for people with health conditions. So it's really important to avoid negatives and focus on positives. Messages with sort of negative terms or tone that focus on the difficulty of life with a long-term condition can be off-putting to this audience who are looking for more positive inspiration and an uplifting tone. And that can be as subtle as, rather than saying, "We know that it is difficult on some days," just saying, "We know that it's easier on some days." Just that slight subtle difference does make a big difference in terms of how well this audience receives messages. We think it's important to remind people of the benefits. Many of the benefits of strengthening are deemed credible and motivating, particularly, as I mentioned, in terms of doing more, but they're not often front of mind. And therefore, actually reminding people of those benefits can be a really powerful way to motivate them. We think it's important to avoid references to pain or tiredness. Language that references those terms involved in doing strengthening, doing something until your arm is tired or painful, that is really off-putting. This audience feels in pain or tired a lot of the time, and the idea that not all pain is bad pain feels a bit crude and unsophisticated. And actually, we found that it was better to avoid using that terminology at all when talking about strengthening. The notion of starting small and improving was very positively received. It really sort of allays fears that there's a really high barrier to doing strengthening in terms of ability, expertise and fitness, and starting small really makes it clear that this is something that anyone can do. And the sort of notion of just slowly improving one's ability is really motivating. We think that providing a really broad range of choices and ranges and options in terms of activity types make the target audience feel much more empowered and the term whatever works for you is a particularly convincing one, because it means this audience sort of feels like they can tailor any advice to themselves and their condition and their ability. It's really important to avoid the use of any technical language. These terms, whether it's dumbbells, squats, lunges, are really off-putting for the least able and least active within this audience and can feel quite exclusionary. They're less off-putting to some of the more active individuals in this target audience, but we think it's important to use any technical terms in conjunction with more accessible options. And that can be as subtle as, rather than saying leg raises, saying, you know, straightening your leg or raising your leg or standing up, something that's a bit more simple and accessible. Finally, we found that introducing a numerical target to aim towards in terms of amount of strengthening to do or number of days on which to do it was quite motivating and helped clarify the ask. But participants felt that it should be really realistic for individuals with health conditions and show a degree of flexibility, saying that, you know, you should be aiming to do around 30 minutes so that they don't feel demotivated if they miss the target on some days when their condition makes it harder to do. The next phase, as I mentioned earlier, was to test some sort of specific creative materials, some worked up messaging that brought some of those learnings to life, which 4 Communications developed, and we then tested with physios and this target audience. And we tested 5 possible creative routes. They all built on what we'd already learned, so they were all relatively similar, but they still had some important and quite subtle differences, both in terms of the actual language and the wording, but also the visual messages that were represented and the emphasis throughout. And what I'm going to talk you through now is the recommendations from after this phase of the research. We found that the 2 routes that work best that we showed on the previous slide were better with strength and stronger my way. Better with strength was the one that really emphasized the benefits of doing strengthening and was quite emotion led. Stronger my way focused more on the process of strengthening, but was really clear that it was something that could be adapted depending on people's different health conditions and lifestyles and abilities. And both of those elements resonated really powerfully. And we think that any sort of messaging should try and incorporate the best of both of those. A second recommendation was being really careful in selection of any visuals when it comes to messaging. That the visual really has the power to engage the audience and convey the key message. And we think it's really important that any people depicted are really relevant and relatable to the target audience in terms of age, body type, clothing, and health condition. It's a really positive and uplifting visual in terms of the use of color and family scenes. It really clearly shows either strengthening activity or something that can be done as a result of being strong. One of the creative routes had a slightly more ambiguous image of what looked like a man sort of hugging a grandchild. And that was neither strengthening activity nor necessarily that was something that was a benefit of strengthening activity, and that was considered quite confusing. And ideally, because this is a really diverse audience, showing different types of people if there are different iterations of any materials in terms of health condition, gender, age, and so on. The third recommendation was that it's important to balance the need for tailoring with the lack of expertise and confidence this audience has. We think it's really important to show that activities can be tailored to the target audience's specific health condition to make it feel relevant and achievable. But this audience doesn't want responsibility for designing a program of strengthening activity. They don't feel confident enough about what strengthening is or their ability to do it. So instead, they prefer to rely on medical expertise to know what is best for their condition. Moving to the next slides, please. Fourth recommendation was that it's really important to explain exactly how strengthening can be done. As I mentioned earlier, it's not a well understood term and it's easy to conflate with general cardiovascular activity. So it's really important to show how strengthening can be done using a range of carefully selected and varied examples and an achievable target to aim for. And any example should be positioned as indicative suggestions People are often quite literal when you provide them with a few examples and assume that those are the only activities available, and there's a bit of a definitive list. So it's really important to make it clear that they are just a few examples of a wider range of possible activities. Physio staff, we found are wary of giving away too much control to the target audience, and there were some concerns that activity might not qualify as strengthening. So any sort of messaging should provide reassurance that physios still retain some control, showing that suggested activities are a point of entry for the target audience rather than a definitive list, and really clearly communicating the role of physiotherapy staff in the process. And finally, we think it was really important to signpost to further resources to achieve behaviour change. Messaging and creatives were able to raise awareness and understanding as well as providing some motivation, but in and of themselves were unlikely to lead to lasting behaviour change. And therefore supplementary resources, which I'll come on to in a minute, feel more sort of practical, appropriate and accessible and more likely to drive behaviour change among this audience. We've got a couple of messaging do's and don'ts. These are quite specific and quite tactical. I'll run through them really quickly before rounding off the presentation. So we think that some of these are quite subtle, but quite helpful. So things like saying gradually increase works a lot better than gently increase, which is feels a bit patronizing and doesn't sort of communicate the ability to improve incrementally as much. Saying both maintaining and improving strength will give any messages broader reach than just maintaining or improving strength, because this target audience has different objectives. Using everyday simple language like raising your leg and avoiding what is seen as jargon like calf raises. It's important to convey that strengthening is easy, but avoid explicitly saying strengthening is easy, because that is something that this audience pushes back on. We think it's important to provide a target and show strengthening is accessible, but we avoid using unnecessarily patronizing terms, such as lifting small bottles, talking about choosing from approved exercises rather than asking the audience to design a program of strengthening, and being really explicit that this is about strengthening and that this is about strengthening for people with health conditions rather than being vague about the target audience or the message. The final stage of the research we were involved in was testing some different concepts and tools for how physios which might support physios alongside any messaging to engage this audience. We tested two broad concepts, if we can move along to the next slide. Two broad concepts for an intervention to increase strengthening with the target audience. These aren't mutually exclusive, and there is some overlap between them, but we thought it was helpful to get feedback on both. One was about a really tailored strengthening program that builds towards achieving a meaningful quality of life goal set by the patient and supported by physiotherapy staff. And the other was a communications campaign designed to encourage strengthening that is built around resources that physio staff can use to support their conversation with patients. And what we found from this final stage of the research was, of the two concepts, there was a preference for option one among physios, the strengthening program. Physios felt that this was giving patients a personal quality of life goal that would be motivating and giving physios a clear role in helping patients achieve this goal. The communications campaign was felt to fill an important gap in public health messaging about strengthening, but there were concerns among physios about how effectively it would cut through to the target audience and inspire genuine change in and of itself, by itself. We tested a whole range of different supporting resources, and I'll show you a bit of detail on that on the next slide. All of them were popular, but physios particularly liked motivational training and guidance on how to talk about strengthening with patients facing particular challenges. And physios felt that any intervention should feature an online hub as a one-stop shop for the different resources, while including offline alternatives for patients with lower digital access. As I mentioned, we tested a whole range of different sort of tools and concepts. All of them were really, really popular. Those that were considered the sort of most popular were training in motivational interviewing and behavior change, instructional animations or video demonstrations of exercises that physios could use to disseminate with patients, a personal progress tracker which included physical progress as well as mood and feelings. Online library of exercises and various other tools were sort of particularly popular, but all of them would help. Our overarching recommendation was an idea of a sort of one-stop shop online hub that physios could use themselves, and they could signpost patients to kind of engage within their own time. That would include all these different resources that I've just talked about sitting under one roof. Could really drive engagement by being visually appealing and interactive. As I mentioned, physios could use it during appointments or let patients engage with it in their own time. And it could be sort of updated and refreshed regularly with new resources being integrated, including sort of access to live online classes if needed. But physios were just really clear that while this sounded like a great idea, it was important to ensure that it was also available in an offline format for those with less digital access. So I've rattled through as quickly as I can, and I'm now going to hand over to Craig, who's going to share some more.
Thanks very much, Ray. And Sarah, if you just put you on to the next slide for me, that'd be great. Brilliant, thank you. So my name's Craig Blaine. I'm founder and director at Move Consulting. And for those that don't know us, we're a learning and development organisation with a specialist interest in physical activity and health-related behaviour change. And the CSP reached out and asked us to engage in this project to help take the insight, the great work of Britain Thinks to kind of the next level, if you will. And I'll share with you some more details about that over the course of this presentation. Thank you, Sarah. So if we just nudge back, that's it, brilliant. So as a slight nuance with regards to the difference, if you will, in the focus of the project element that we're looking at, is our target audience has turned to look at the physiotherapy staff specifically. And what we're aiming to do is support them in delivering strengthening guidance and tailoring support through strengthening activities to their patients. So the end benefactor still remains the same, being the patient groups that you can see on the right hand side of this slide. But we're focusing in, as I say, on that physiotherapy staff as an audience to try and unpick some of the behavioural wants and needs from their perspective. So if we move on to the next slide for me there, thank you. So effectively, our project has 4 phases incorporated within it. The first are design characteristics, and effectively what we're aiming to do is define the challenge or the thing that we're aiming to change in behavioural terms. So we've looked at where we would like to support physios in delivering strengthening guidance and activity, and we've worked with them to understand what that would look like. That supported us to help identify some design characteristics, so effectively the way in which we can go about supporting enhancing practice or the prevalence of target behaviours of the physio in delivering and supporting strengthening activity. Where we move on from that phase is into an intervention design and build. And one thing to bear in mind here that's really important and has been a huge feature of our work is that co-design sits at the heart of everything here. So we're working with the physios hand in hand to understand, on the basis of the aims that we have for the project, to make sure that they're relevant, they fit in a context that would work for them, and they're easily applied and applicable to those different elements. Moving beyond that design and build, what we want to make sure is that we have the testing of that program kind of looked at in as in-depth a way as we can. So we're working over the next 2 weeks. In fact, we initiated it from yesterday, the next 2 weeks of testing some of the suggested intervention characteristics with a group of physiotherapy staff to help us understand where the context and the successes of those tools that we've identified work. And then finally, we'll identify some finalized resources that will play part of a potential toolkit to support physios in that sense. We'll use that learning and insight to help us develop a phase 2 and look at scale. So in terms of the project phases and helping to support, I alluded to earlier on, we're doing some co-design and working with physiotherapy staff. There are two main ways in which we're doing that. The first is that we have an ICSP strength community set up. So there are over 100 members, as you can see on screen there, and we're engaging with them over a series of 1-hour sessions, asking key questions to support physios to explore some of the key questions that we're uncovering. And then we also have a cross-profession expert working group, which is a smaller, and we're having more in-depth qualitative and quantitative conversations with them around how the intervention characteristics would work in practice. So as you can see there, we're working with them over 4 sessions of around 2 hours, and they are our team of experts that are supporting us with regards to testing tools and making sure that any intervention is fit for purpose. So if we go on to the next slide, Sarah, thank you. Now, I mentioned earlier on that one of the first things that we wanted to do was define the problem in behavioural terms, and linking in with the great work that the team at Britain Thinks have done, what we've identified here, and the diagram on the left-hand side of the screen is just to bring it to life in a visual form, is we've considered the behaviours that have been identified from physiotherapy staff through that research to understand whether we have any critical behaviours that could be more time effective, if you will, resource intensive in terms of working on to support and change. So to bring that to life, if we consider behaviour number 5, which is in the centre of the map there, that's defined as there's a perceived difficulty in opening conversations and answering questions around strength for the physio on the basis of, for an example, the CMO guidance doesn't quite give enough, is some of the feedback that we've had. And that behaviour in itself impacts on all those that you can see circled in red around it. So a perceived difficulty in opening that conversation could impact on the ability of the physio to empower clients beyond or before their session in terms of information provided. That may impact on their motivation to engage in that conversation, as an example. So that's just an insight into the approach we've taken to identify key behaviours. If we go on to the next slide, please, Sarah. The next step, and again, another point to show the link between the work from Britain Thinks across to the work that's continuing with Move Consulting, is we're using the COM-B model, which you can see on the right-hand side of the slide here, to consider the different elements that are impacting on physios and we need to make as part of our considerations for future. So through that, we're considering the capability, motivation and opportunities that physios have within their practice to try and drive some of the behaviours that we're looking at. We've also taken the time to explore if there is a standardised structure to a degree to a consultation, if we were to call it a generic structure. And these key points that we can see along the line kind of highlight some of those key phases. One of the points that was made to us is that we know that each individual physio and their setting may be unique in their approach, as will their patient or the patient group that they're working with. So as much as this is presented in a line, it is by no means a linear process, and a little bit like the Morecambe and Wise sketch of we've got all the right notes but we're playing them in slightly different order each time. We may see these move about, but what we've taken the time to do is define where those behaviours we've identified are taking place, and this leads us to support the development of tools and resources to support those behaviours to be seen more readily. If we move on to the next slide, Sarah, thank you. So as mentioned, this is an ongoing process. We plan to complete our phase of the project and present back recommendations for mid-April. But so far, there are 4 key areas that are coming forwards as themes at the moment. There is a high importance being fed back from physiotherapy staff around the need for communication skills in conveying the strength messaging that's come through. And again, the insight from Britain Thinks with regards to some of those key points around language are really, really going to support that element moving forwards as we look to develop those tools. Understanding patient need and recognizing that each patient is individual in their treatment needs, and the way in which we may support them is critical to everything that we do, and tailoring advice is certainly one of the highest priorities that we're hearing. Making it relevant to the individual and empowering patients is another key consideration that we're hearing a lot of, and that requires a number of different factors, but as a couple that are coming forwards, there's the need to understand the patient's needs beyond their clinical need and their kind of history or the opportunities that they have, the motivation that they have to drive that forwards, on the basis that a physio may engage with someone at one time point and then send them away to work on their strengthening activities independently, if we could call it that, until they see them again. So to emphasize point 4, there's a really high prevalence coming back of the need to empower patients to work beyond the physiotherapy consultation itself. If we move on to the next slide, Sarah. So the next steps for us, as mentioned, we've just initiated our testing phase with some key tools that we've identified. So ultimately, in terms of those tools, what we want to do is identify them, put them into some practical testing, and that will help us plot an understanding of where there are potential gaps with regards to existing resources that can support physios in this sense. We're going to work against agreeing a consultation framework and plotting those tools against it. So again, that concept of the line going through a generic physiotherapy consultation. And then we're also considering where messaging and tools can be potentially used by the broader healthcare professionals across different kind of settings or with different audiences as well. We'd place all of that into the recommendations that we have for the project and then move into what we would see as phase 2. So finally, it's an opportunity really for people to get in touch if there is anything that we've mentioned today that's inspired, or you've got something that you'd love to share. We are in that process of collating information, so please do use the contact details you can see here to get in touch. And John mentioned earlier on about the hashtag talk about strength. So what would be really great to see is, from the presentation so far, what's exciting you about this project that we've described to you so far. And if you use that hashtag talk about strength, it'd be great to see what comes back. Thank you very much.
Okay, so over to me to do the Q&A. Okay, thanks. Thanks to everyone who's been sending in questions either in the chat or the Q&A. There's some great questions coming in that are really interesting, and I'll start to put these to the panelists. Just a sort of factual one to start with for Raf at Britain Thinks there, just about the, we've had a few questions in about the sample size, about representation within the sample and how those that sample was put together. If you could perhaps just talk to us about that, please. Yeah, definitely. It's an important question. So over the various phases of the research that we did, don't actually have the exact number to hand, but I think it was about 56 people we spoke to who were in the sort of patient group, the people with long-term health condition group. So it's a qualitative piece of work. So it would never be a statistically representative sample. But what we did do is ensure that we had some quotas in terms of things like age, gender, socioeconomic group, ethnic background, and various other factors that made it a sort of a diverse and balanced group that felt sort of typical of the wider audience without sort of strictly being statistically representative, because no qualitative sample can be. So that was the target audience side of things, people with health conditions, and then I think we spoke to about 40 or so physios in the qualitative work we did with physios over the different stages, and they were drawn from CSP's own membership. So I hope that answers the question. Thanks, Raf. Yeah, and as you see from the summary report, this work obviously commenced before the pandemic, but we recognised as the pandemic hit that we would need to introduce additional element, and I think Raf touched on that in his presentation, just to sort of see how the pandemic and lockdowns and shielding were impacting upon our target audience and their feelings and beliefs towards activity and strengthening in particular. So thanks, Raf. Okay, one for Susie. Well, a couple for Susie really, about one about how the findings of this can be built into the We Are Undefeatables campaign. And also there was a question early on around what constitutes strengthening in terms of, do racket sports count, for example, and are there other types of activities around? So if you could speak to that, please.
Yeah, sure. Good question. So first one, we're undefeatable. Yeah, 100%. So there's a lot of existing work that this insight is going to feed into, because obviously as Sport England have a lot of work programs going that this can inform, of one of which is We're Undefeatable. So we're speaking to the team and have shared the insights around the marketing, both in terms of the charitable work within the Richmond Group of charities, but also in the marketing and promotion of how it represents strengthening activity, and also the activation points that it has. So in moving forward within those campaign bursts, will be incorporating strengthening activity. That's not to say they haven't already, but it's just insight to enhance what they have for that audience. And as well as that, we are looking at how this girl can use this insight and also join the movement, which has been our campaign that we've launched over COVID. So yes, we're looking at existing work that this can feed into, but also exploring new work too, in light of the new strategy and what that means for us and also our partners. And in terms of the question around racket sports, yeah, there is, I guess, if you like, a sweet spot where some activities are both aerobic and strengthening, improving. It doesn't have to be an either or. Which is great. So it's a kind of limited evidence base, but racket sports definitely do. So racket sports are particularly good for improving bone health and balance. And there's kind of a moderate one around improving muscle function, but it also hits that aerobic one as well. So yeah, it's a good all-rounder, racket sports. Hopefully that answers those questions.
It does, yeah. Thanks, Susie. And one of the things that came through in the findings were around those sort of perceptions of strengthening, often related to heavy dumbbells in a gym, muscle bound people, and what we're hoping to get across is that strengthening can be other activities as long as they challenge the muscles. I think Sport England are coming up with a nice sort of formulation of wording for their regular active live survey that involves causing the muscles to shake or tremble or something like that. I can't remember the exact wording, but it's nicely put, that emphasizes that it doesn't need to be those traditional strengthening activities that many people think about, and tennis is a good example there. One for the CSP crowd then. This is we've had quite a few questions in from other professionals asking about how what our thoughts are really on that broader team that is available to people, and how that physios can work alongside fitness instructors, other exercise professionals as part of a team, so that the patient, the service user, whichever setting is getting the expertise they need. Sarah, would you like to pick up on that?
Sure. I mean, the very short but true answer is it's essential. And I've said it a couple of times, but it's personalizing it to the person in front of the practitioner in terms of what they need. But physio can't do this single-handedly, and physio are one of the first group of practitioners that would say that. And that's why in real life, and people mentioned it, that's what happens. Those are the examples that are working, and we want to build on that, and we want to do more of the stuff that's working. And it's why we're working in the alliance, why we're co-chairing it and really pioneering that work forward, because we believe there's a range of practitioners, including the folks working alongside physio.
Great, yeah, and our community rehab alliance as well involves. Sorry, I've got a bit of an echo there. Sorry, are you able to just go on mute, please? Thanks. Great, thanks. Yeah, our community rehab alliance is made up of I think 47 health and care professional bodies and patient charities and the like, is sharing a lot of the findings here for other professionals, but also looking at new models of care particularly for rehab in the community to ensure that patients see the right person at the right time for that. There was questions that came through as well about older people as well. The main focus of this work was at 39 to 64, but we did look a few years either side of that to see whether there was any pickup. Did anyone on the panel want to just sort of pick up on how this can feed into other work around older people in particular? Any takers?
Sorry, I missed the question.
Yeah, so the question was also about how relatable these findings are for working with older people, and what any sort of work we'll be looking at doing there.
I guess the reason that we picked that age group, just to set a bit of context, was because this is we were kind of swimming upstream, if you like, a little bit. So not looking at where people are already deteriorating in terms of their strength, but actually swimming upstream and looking at where the evidence base is least. And it does seem to be that area. And particularly when you move to the 65 plus, the sort of balance and later life stuff comes in terms of the guidelines as well. So that sets a bit of a context as to why we were working on that. But I guess it's not the falls prevention work, but it is actually prevention work, if you like. It's about encouraging those messages and those physical activity habits earlier on in life, as opposed to waiting to sort of the later life work. But Sarah, do feel free to come in on that.
I can just add to that as well, just to say that the findings from this work sort of do echo some of the work we've done with other audiences as well. Including older audiences, in terms of sort of making any sort of messaging feel sort of really relatable. That some of the barriers we heard were similar as well. I think where it might differ is in some of the specific motivations that will feel most relevant, and the specific activities that will feel relevant and accessible to different audiences. But some of the kind of overarching learnings definitely felt quite transferable to different audiences.
Right. Thanks very much. And there's a question actually probably that Craig's best placed to answer in regards to connecting with harder to reach groups who are perhaps reluctant to engage with activity advice or strengthening advice. And the work you're currently doing with a steering group of the physiotherapy workforce is quite helpful here, I think, in terms of looking at the behaviours that the professional needs to display. Did you want to just speak to that, perhaps?
Yeah, in terms of reaching a more diverse audience, let's say, I guess the key part to it is making sure that the practice of anybody that's conveying strength, because one thing is that the CSP and physiotherapy as a profession wants to lead the way on strength, but then the learning from this project as an outcome we hope could cascade both across wider health professions, but then into general practice for everyone, from a volunteer delivering a racket sports session, since that came up before. So what's really important is the way in which those messengers are perceived. Raf mentioned earlier on about the trust levels that exist, and what that does is position physiotherapy staff as part of that wider community of healthcare professionals really high on that agenda. So making sure that the perception versus the behaviour seen, because that's what the lay person, patient, for want of a better phrase, would see first. Making sure they connect is really, really important to keep that level of trust that's already there. And then, as mentioned, to cascade it down so people gain trust in as many people as possible. So we get this message out, because consistency is so important. I hope that answers it.
Yeah, thanks, Craig.
No problem.
In terms of the sharing of these findings, we've had a few questions about the sort of resources that are being created and what we'll be doing with those. Sarah, did you want to just come back in on that about our plans to connect with other professions and also the resources that have been created so far?
Which Sarah? Was that me, Sarah, or Sarah C?
Oh, sorry, yeah. Well, either actually.
Do you want to talk about next level, Sarah? Do you want me to say?
You can take this one, Sarah. Thanks.
Okay. So that's one of the things that came out really really strongly in the insight was the need to have a place where people went and could share whatever it is that's going to really get people to invest and commit and see through the strengthening work that they're going to do. And that's once people have sort of come over that that barrier and that relationship that they've built to really kind of feel they're able to do it. So that's part of it, is developing what that looks like, what that is, what part of the patient sort of their journey to get stronger, their journey to their goals, do they need, what they need in each part. The other is, and people have touched on this quite a bit, is that capacity building. So the role that physio can play to really, someone talked about this whole idea of that kind of misinformation that's given out by other practitioners. And so that's the other sort of bit of resource. So what's happened so far is the piece around that's been put out to date, is the report itself amongst professionals, but it's that what people are going to use, and then what they can use both with the patient themselves, but also people that we're going to work with, and are going to work with the same patient. That's both, that could be within the GP surgery or the wider team in the community. And Sarah C is right for this. So let's talk about strength handout, which has those top tips. So this is where this next phase is most important, but that's what's in. And John, you're probably well placed to sort of build on anything I've missed off more specifically.
Great. Yeah, I mean, most immediately we've got the report, which is excuse me, sorry. Which is available now on our website, and we'll make sure everyone has the link. We also produced this one pager that Sarah's mentioned in the chat there, that talks about the motivations and barriers that people with long-term conditions told us they experience, but then also gives you really sort of helpful advice on the do's and don'ts, really, of the language that you use when discussing strengthening. These are the things that people living with long-term conditions told us they want to hear or what they don't want to hear. So that's a really sort of useful at-a-glance guide that we'll make sure everyone's got access to. And then it's about exploring what resources already exist. There's some good examples. I mean, thanks to Leon for putting into the chat there the work he's done. A whole range of resources are out there already. So it's about us identifying which are the best for strengthening, seeing where the gaps are, what we can add to that, and that's what we'll be doing in the coming months. Actually, Raf, there was one point there that, about the information that people receive that sometimes from health professionals that sometimes deters them from doing strengthening. Did that come across in either the interviews or focus groups?
Yeah, definitely. A lot of the people with health conditions we spoke to had said that one of the reasons I don't do much physical activity or strengthening is because actually I've been told by a nurse or other healthcare professional that the best thing to do is rest. And that was something that the physios we spoke to had encountered as well. They said that often some of their patients, when they tried to deliver advice, would say, well, actually, I've been told by a different healthcare professional that the best thing for me to do is just rest. And there seemed to be a bit of a conflict there. And that led to some confusion on the part of some of the people we spoke to.
Thanks. Yeah, which really reinforces the importance of this work and us sharing it with other professions and making sure that, well, within our own profession and beyond. So there was actually a question to that point about what people can do themselves to help spread these findings. We'll make the link. They will make the report available. We'll make the one pager. I think those are the most immediate things to do. If you're in the physio workforce, please join our ICSP group. Again, the links I think been put in the chat. But yeah, more broadly, use the hashtag talk about strength on social media and keep the conversation going. And yeah, just talk about strength as much as you can to the people you're seeing. We've got this great report behind us now, and I think that there's been some really good responses to it so far, and we're excited about where it can go next. But the first stage really is just to start sharing these findings, get people reflecting on what it means for their everyday practice, and taking it from there. Are there any more questions that have come in?
John, I think that's a really it's so important, because one of the themes that seems to emerge from quite a lot of the comments really just reinforces that people's journey is not linear. It's not like you may come in through where you've been referred with a more senior practitioner who might be more trusted automatically but then you move through the system and you have a great relationship with professionals in the community exercise. You really continue to build on that, but at some point many points people may move backwards and forwards, particularly talking about multiple conditions, or people may relapse, and so that's there's a lot of talk about building those relationships in the community. That's absolutely critical. Taking that report and maybe saying to your own service, what are we doing that really supports this? What could we be doing differently now? What could we be doing differently 5 years from now? That helps to sort of enter into like how the services need to be designed or reimagined in some place. So how to build on excellent ones and make sure they remain excellent. So use it as a real opportunity to grow what's great and challenge what could be.
Great. Thank you. I'm just going back into the Q&A. Let's just follow up for Craig, actually. Do we currently have a way of uniformly, is that how you say it? And accurately quantifying willingness to change?
Oh, the short answer would be no on the base of uniformly. So with regards to what we're aiming for, the process that we're following in developing the tools, the first step is to ask the question. So back to the importance of co-design and making sure the voice of physiotherapy staff is heard. The first question is, what is the problem that we're aiming to solve, or what is the change that we're expecting to see at the end of everything that we do? So ultimately, from a behavioural perspective, we have that in mind and we keep that as our project aim. We complete the work and follow the process, and then we check against that. So ultimately, is what we did leading to the outcome that we expected to find? What we do expect as part of that is that it won't be a smooth process. By all means, you may have seen the visual of what people see or expect success to look like being one point to another with a straight line, and it's actually a bit of a mess. So there's lots of forwards and backwards steps going through that. As a result, that comes back to the point of it being a uniformly kind of approach, because there may be slight nuances. But I hope, again, that answers that question. If there's anything more, please do pop into the chat and we can pick it up.
Great, thanks, Craig. There's lots of comments coming in, comments as much as questions around collaboration, really, which speaks to the heart of a lot of the success of this work in the future. There is so much expertise among different professions, and it's about joining it all up to make these services available for people and make sure there's that communication between professions and respect between the professions. I think one of the really important things for us from doing this work is, strength is often referred to as the forgotten guideline, and I think what's so pleasing about the response today has been how there is this expertise and this understanding that strength is really important. It's about getting that collaboration right so that we can really kind of bring it to the fore a bit more and make it more visible for people, who will benefit from it. I don't know if there's any more questions.
There was one, John, at the very start, because this has been great, a lot of engagement. There's one at the start around the sort of the guidelines themselves, and those about is there a disconnect between sort of government and what actually happens on the ground, and I don't know if Susie wanted to sort of talk about that at all, because it does feel like that was the basis for why this partnership came together, that the guidelines were being published, and it was felt when we were talking about what we could do to bring them alive, we realized that actually there was this quite substantial gap in what we knew. So we knew loads about activity, and particularly the work at that time that Sport England was doing with the Richmond group around We Are Undefeatable, and we had done that work around love activity, but it wasn't the same, and it had taken decades just to get to that place of activity, and so that's how it came about. But I don't know if Susie wanted to say, or Raf wanted to say anything more about, you know, the response about the guidelines not being particularly helpful in its raw format.
Yeah, sure. I can pick up on that. Oh, I'm getting an echo. Is anyone else getting an echo? Oh, there we go. That sounds better. So yeah, the guidelines are not produced as a front-facing public consumer message. They are around the evidence base that says, you know, for optimum health, what should we be doing, and more to inform work. So yeah, it feels like the way we have to think about how we package that and how it can connect and resonate best with the public, recognizing that you know, we need to take they're not a unique sense of one set of people, they're unique individuals, and how do we look at those who are you know, we have more inequalities with in terms of physical activity. So it really is about that translation of, that's the evidence base of what we should be doing and what's best to live an optimum healthy life. So how can we then translate that into supportive messages through the work that we do, other health partners do, other sectors, and promote that in a way that's digestible, user-friendly, and actually triggers and supports that behavior change. I'm not for one saying that it's an easy job, but there is, you know, work to do, I think, in this space around translating and supporting that change in behavior. But Raf, feel free to pick up on that as well and speak to that question.
Yeah, I mean, just to echo what Susie said, I mean, part of the reason for doing this research was to understand what needs to happen in order to make the guidelines accessible and engaging for people. That's why we showed them the guidelines, to understand how do people interpret them, and what else do they need to see for them to make sense and be motivating for them. And hopefully some of the sort of messaging that we developed and tested in later stages of the research made them more meaningful and helped clarify them for this audience.
If I can add as well, that's an echo that's continuing into our work with regards to identifying the tools. So obviously, as we've mentioned, the CMO guidelines as an infographic aren't designed as a tool to necessarily be given to the public to follow up with their work. So there's potentially a gap there of a need to develop something. And in addition, in terms of the message being shared and potentially that approach for the physio to consider and what tools fall out as a result of that, is the message around strength as part of general physical activity, health and well-being, rather than only to treat or support somebody with an acute condition. So as much as possible, and that's really good in a sense to hear that it's a continued theme that's coming through, because it tells us that it's an area that we should look at to try and ensure that we support the physios to do so. And it speaks to that point that came up earlier on around the consistency around what's coming through. So I hope that helps.
Yeah, thank you. That's a really good point. No, thanks very much to everyone for all the questions and the comments that have been coming in. I hope we've answered as many of them as possible. Any that we've missed, if you'd like to follow up, our email address is strength@csp.org.uk, and having stumbled over that, I will put it in the chat to make sure it's a bit clearer for people. And I'll hand back over to Sarah now.
I think we've lost Sarah Hazard, so I'll close up. And yes, thanks, John. If you could put our email address in the chat, that would be fantastic. So just a few next steps, and thanks so much for all the questions that you've shared. As I mentioned, the full report and summary report and updates are shared on our www.csp.org.uk/strength pages. So do head there for more information. Updates will be made through there, and if you are a CSP member, do join the ICSP Strength community group as well. Keep sharing your comments, talk about strength, use the hashtag talk about strength on social channels, share your views and thoughts on the findings, and then towards the end of April we'll be sharing the findings from Move Consulting's and our proposals for Stronger My Way into the next phase. So thank you all so much for joining today. It's been great to have the conversation. Sarah's back. And yeah, do head to our website and share any questions that you have outstanding with us through that email address. So thanks to all the panelists today, and really good to have the conversation.